Hello, everybody. Let's take this opportunity to share something from my clinical practice. So, all these years in homeopathy, what I have seen and I believe is that whenever a homeopathic doctor sits in his or her clinics, we strive to find the best possible cure for our patients. We are all there learning different skills, learning different styles of case taking, of repertorization, of materia medica, with one goal in mind, that's cure. Maybe our methods are different, the routes that we take is different, but we all have one single focus in mind, that is the ultimate cure, and make sure that our practice grows. Now, what are the five mistakes that there are some mistakes we do in our practice, and one of these are we focus on materia medica. We focus on repertory, we focus on pathology, we focus on drugs, drug pictures, we focus on thematic prescriptions, we focus on system, we focus on this, we focus on that. So there are a lot of things. And I look at some curious eyes and you're wondering, why do I say that focusing on pathology is a mistake? Why do I say focusing on materia medica is a mistake? Yes, it is a mistake if you're only focusing on your repertory sheet, if you're focusing only on your materia medica, if you're focusing only on understanding a remedy with aspects of theme or a pathology. Because Hahnemann, in his years of practice, saw that despite of doing successful prescriptions, despite of remedy meeting the simillimum, there were failures. And he had cases that came up to him with lots and lots of failures. He will give a remedy, patient will get better. But then after a few weeks, the patient came back sick. And that's where he came to an idea and a principle which is so important and which is so neglected by every homeopath. And that idea is theory of chronic disease, theory of miasm. He came up that the disease influence does not completely go away because of the fundamental cause of the disease or the taint that is inherited. We know now that a lot of modern medicine talks about genetics and importance of the disease that has traveled through generation after generation. A disease being specific to a particular race, to a particular community, to a particular sect. Now, this was said by Hahnemann even before the discovery of genetics in theory of chronic disease. Now let's turn a few pages back into your Organon book of medicine, where he emphasized tolle causam, tolle effectus. So in every lecture of mine and every time I'm with my patients or with my students, I tell them that this line that Hahnemann has given is not just few words, but it is the ultimate truth of homeopathy. Tolle causam, remove the cause. Tolle effectus, remove the effect. So unless the cause is removed, the effect will not be removed. So now this changes the whole perspective of how we are looking at our cases. So if I sit in my clinical chair and I'm busy searching a repertory, searching a rubric, and then seeing, okay, 1, 2, 3, 4 rubrics are matching so-and-so remedy, and hence this remedy, my job is done, then I am completely wrong. Because Hahnemann said that unless and until you are treating the cause, you're not treating the effect, which means unless and until your remedy does not touch the miasm, you are not touching the cure. In order to complete cure, your remedy should match with the miasm. And this mistake that I realized in my practice, later in my practice, changed a lot for me. So today when I sit in my practice, one year is thinking about what could be the remedy. One year is thinking about what could be the miasm. What are the, sorry, not the remedy, characteristic symptoms. Another here is saying, what are the characteristics miasm? Hahnemann gave us 3 miasm in his lifetime, but it was not limited to this 3 miasmatic understanding. Let me give you a very quick example. I was struggling with a case of an arthritis, and I spent hours in case taking. I spent hours understanding the remedies. I will go on my software and try to find the remedies, etc., etc. And all my best selected remedies were failing unless and until I found a pattern which was not just of not just of a system understanding of a plant or a mineral or an animal, but I also saw a pattern in the reaction. I saw the pattern in the pace of the disease. I saw how the disease started and how it developed. So in this particular case, I gave her several remedies which were focused on anticipation, which were focused on anxiety, in how will my future be, okay? And that's why I gave a lot of mind remedies for anticipations like gelsemium, pulsatilla, etc., with no relief, no particular relief, unless and until I came to this point where arsenic was another remedy I gave. Then, so varied remedies I was giving her here and there, till this final recall with this patient where I asked her, tell me, where did the disease start? She said, I distinctly remember my disease started few years after my marriage. And, after my marriage, I will get a recurrent urine infection, vaginal infection, and I was treated with lots of antibiotics. And then slowly, after few years, I had some difficulties with my pregnancies, and I had to undergo hormonal treatment. And after that, I developed this disease. Okay. And in this, throughout now, I see a pattern at a pathological level where the disease started with infections, recurrent infections, use of antibiotic. Okay. When after, and that's what Hahnemann talks about in miasm psychosis, that this is nothing but a case of honeymoon cystitis. Okay. So post marriage, any kind of discharges, any kind of infection, especially around the pelvic area, followed by the pattern I saw in her life. Okay, that there was constant state of anticipation that what's going to go next wrong, what's going to go next wrong, and then kind of accepting that she is never going to get better, and then avoiding every little thing that she could have, like her life will go in avoiding different kind of food, avoiding different kind of events in her life. And when I understood this whole complex, I gave her medorinum, and which beautifully cured the case of arthritis. So my dear friends, miasms can never be overlooked. And this case taught me that unless and until we treat the cause, we are not treating the effect. And miasm is not something that's theoretical, but it is something that we use in our day-to-day practice. So let's remember every time when you are seeing your patient, how are we going to address the miasmatic understanding of the case? Thank you.